And he is your best friend, your buddy, but what happens if your pet stops breathing? What you can do to save their life. A lesson in pet CPR. Hey, we've all heard about the importance of learning CPR to save lives, but what about for our pets? It's a good skill to know for them if your dog or cat ever runs into trouble. Dr. David Gonsky joins us today from West Loop Veterinary Care with some suggestions. Thanks for coming in.
My pleasure.
When
Thank
you guys first told us about this, I had never thought about doing pet CPR. What kind of scenarios are we talking about that this would actually be helpful?
So choking situations, if your dog or cat is choking, near drownings, allergic reactions, and trauma are big ones.
Okay,
like
and is
hit
it
by a car.
Okay, oh really?
Yeah.
Okay, and so when do you know you should do this?
Okay, so generally, if a dog is going to need CPR or a cat, they're going to be collapsed.
Okay.
They're going to be collapsed, and then you're going to check for a pulse and for breathing. And if those aren't there, you're going to start CPR.
Okay, so where do we check for the pulse?
Okay, so a couple places, and this is a little model that will help us out.
Okay.
So one is deep under the, I call it the leg pit.
Okay, the leg pit.
You can feel, and this model has a thing.
So you have a device that you can show me feel it. So if I go home and feel my dog here, I'll feel the pulse.
Yeah.
I didn't know that.
Yeah,
okay.
It's deep into the leg pit, just up against the skin.
Got it.
You'll
And
feel
I feel
a femoral pulse there.
And then if I don't want to feel it there, I could try to feel it in the middle too, you said?
And I was just saying, just grab the chest, kind of in the armpit area. And you're just going to feel, because if you've got, I'm a lefty, so I do it here.
Sure.
And I've got my bulk of my hand underneath this here, and I can feel if there's a heartbeat going in there.
Okay, so I have felt the dog, I do not feel a pulse, and now it's time to do CPR. Where do we begin?
Okay, so we're going to first check to make sure the dog's not choking.
Okay.
Or cat. We're going to open the mouth and kind of pull the tongue, look in.
Okay.
Okay. If there is something there, a ball, a bone, or whatever, try to get it out.
Okay.
Use your fingers. If you don't have fingers, use like a spoon, a dull knife. It doesn't matter. Any harm that you can cause trying to get that out, we can fix at the vet's office.
I have to say, I would worry doing this that maybe they would freak out and bite me.
Which would mean they're not collapsed and they're not having...
Then you wouldn't be doing CPR. Okay, that's important. Yeah, very good. Okay, so I've determined that he is collapsed. There's nothing in his throat. Next, what?
Yep, so you're going to extend the neck and head a little bit. You're gonna kind of go, you take the arm and bring it back till you find kind of the armpit area. Like you take the elbow and it's gonna wind up on the chest somewhere.
Got it, right here.
Like, it'd be about right here.
Okay.
And then you're gonna put your palm there, other one on top, straighten your arms.
Just like I would for
a human.
Yes.
And then just start going.
Okay.
You're gonna go about 30 beats before you do 2 rescue breaths.
30 beats before 2 rescue breaths.
And I'm not counting.
Okay, so let's say 30. Let's say you did 30.
30. Then I come over here, and I'm going to just close the mouth, breathe in the nose.
And cover it up.
Yep, 1, 2.
Okay.
And then go back to doing this. And you want to do about 120 a minute, or just sing Staying Alive to yourself.
Yes.
And just staying alive, staying alive.
Okay.
And that'll give you the beat that you need.
Right.
To get this going.
Okay, this is really helpful because, like I said, this is not something I necessarily would have thought of. So you keep going, maybe, I don't know, you can't call an ambulance is not going to come for this, right?
You keep cycling.
Okay.
Ideally, you have a friend or someone with you who can help get you to your any nearby veterinarian, because time is of the essence. If not, you can try to call a friend, but go about 10 minutes. If nothing has happened in 10 minutes, you can probably stop.
Okay, wow. Okay, so this is
cycling.
interesting. Now, we have heard in cases of people with CPR that if you can't do the breath parts, at least do the pumping of the hands. And here's a breakdown of what you have basically told us. So we're going to lay the dog sideways, or the cat, clear the airway, do the breaths and the compressions, and then keep going for 10 minutes max. Yeah, you think at that point?
That's a reasonable amount of time.
Yeah, okay. And so my question to you then is, if I don't want to do the breath compressions, like some people don't want to do that with humans, is this enough?
You know, it's worth trying. Like I tell, when I do demonstrations on this, do anything you can do. It's better than nothing.
Right.
If you don't feel comfortable and you don't, then you don't. But at least look for choking, do the compressions, and try. Okay.
You were always so helpful because I never would have thought of this. Never in a million years would I have thought of this. Have you ever had any patient who's done this to bring a dog in that it made a difference? Has that happened yet?
Not yet.
Not yet.
But I hope one day.
Yeah, and I hope we all can learn from this too. So, Dr. Gonsky, thank you. Great advice from West Loop Vet. What's your westite if people want to learn more?
westloopvet.com.
Very nice. Thanks for coming in.